Okay, cervical disc, gotcha.
Whatever you want to call it. Yeah.
You fixed me, that's all I know.
That's perfect. Okay, whenever
Go
you
ahead.
want. Yes.
Hi, my name's Mary Subia. On February 21st of this year, I had an artificial cervical disc replacement surgery. Pain before then was, I wanted to remove my own left arm, and pain 5 minutes out of surgery, non-existent. And to this day, no pain.
Excellent.
So, yeah, thanks to Dr. Smith, and metal's the way to go. Yeah.
Thank you.
Thank you.
Okay.
All right.
We'll see you back in probably a couple months. Check on you.
Couple months.
Make sure.
And no restrictions anymore? Just
Whatever you
live
want
life?
to do. Sky's the limit.
To an extent. Thank you so much.
You're welcome.
I appreciate it.
Have a good day.
You too.
Hello, and welcome to the El Paso Spine Center. My name is Dr. Dean Smith, and today, along with my assistant surgeon, Dr. Bogosian, we will be helping an individual with a huge disc herniation in her cervical spine by replacing that broken disc with a new artificial cervical disc. She has a herniated disc at C6-7, and these have traditionally been treated with a fusion using plates and screws. The problem with plates and screws is the plate itself can produce difficulty in swallowing from the fact that it's behind the esophagus, and the plate is designed to produce stiffness in the cervical spine or the neck. Therefore, if you fuse 1 or 2 levels in the cervical spine, that will place additional stress on the other levels, and those levels will wear out more quickly, leading to the need for additional surgical procedures. The goal with an artificial cervical disc is to increase the motion at a level that has previously lost motion to lessen the stress at other levels. In other words, if you have a patient who has a herniated disc at one level and the next level may not look so good, if you fuse one level, most likely you're going to have to fuse both levels, because in fusing one level, you're going to place more stress at the next level. As opposed to with an artificial disc, you can treat the herniated level, increase the motion at that level, and thereby releasing the stress or decreasing the stress at the next level and actually helping that level. Some other advantages of an artificial cervical disc include the fact that postoperatively or after the surgery, you don't need to wear a cervical collar. And in fact, we actually want you to use the disc. The more you do, the quicker you do it, the less scar formation you have. Therefore, it's back to normal activities sooner. And it can be done as an outpatient. Typically, return to work would be in about 2 weeks or less, though you cannot do any heavy lifting for about 8 to 12 weeks until it heals. When we're doing this, initially we will remove about half the cervical disc, and we'll do this using monitoring, and that is real-life monitoring that will tell us how the nerves are functioning. And then after we remove half the disc, then we remove the remainder of the disc away from the nerves using the surgical microscope. This is a actual cervical disc. You can see it's composed of 2 metal plates, and between those plates are some plastic, and then that allows mobility at that level. And what we do is we impact this artificial disc in the disc space where the patient had the damaged disc, thereby relieving the pressure on the nerves, relieving the pain, and making them happy. Thanks for watching, and I hope that answered some of your questions.
When it rains it pours, when the floodgates open, brace your shores. That pressure don't care when it breaks your doors. Say it's all you can take, better take some more. Cause I know what it's like to test fate. Had my shoulders pressed with that weight.
Remember to look us up at elpasospinecenter.com and also to like us on Facebook. Thanks again.
Strong in spite of that hate. Night gets darkest right before dawn. What don't kill you makes you more strong. And I've been waiting.